Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And technology is going to play a big role, and is playing a big role with the improving consumer engagement in the marketplace. And joining us to talk about that subject is Stan Nowak, the President and CEO of Silverlink Communications. Stan, good morning.
Good morning, Doug. How are you?
I'm doing fine, thanks. You're a little faint here. I think I hear you.
Let's see. That helpful at all?
There you go.
That's good.
Yeah, we got you. Thanks.
Okay. All right, great.
Yeah, good to have you, Stan, and thanks for joining us. Give everyone just a brief background around Silverlink, then we'll talk about, some of the things you're doing around utilizing technology and human touch together to improve consumer engagement.
Sure. Silverlink is about a 12-year-old company that's exclusively in the business of motivating health behaviors on behalf of health plans, pharmacies, and health management companies. So we use technology to motivate incremental health behaviors among consumer populations, whether they're health behaviors, health management behaviors, or membership behaviors or economic behaviors. And we do this on behalf of payer clients principally, 500,000 to 1 million times a day. So we've been doing that for a dozen years. And so really the problem statement is, how do you motivate the behavior of populations at home as they're making these critical health decisions around managing chronic conditions, getting the preventive screenings that they need to get, staying out of the readmission world, and those kinds of things. So that's the principal business of Silverlink.
Okay. You talk about the combination of technology and human touch leading to successful engagement. So why do you see that being so important, the combination of those two?
Yeah, where we are today in this marketplace, the combination of technology and humans is absolutely essential right now. And where we are today is with 8 million new members coming into these health exchanges. The critical issue around health exchange populations is, remember, the exchange doesn't have an HR department. So an individual consumer needs to be directly communicating with the health plan to get the guidance and navigation that they might have in another setting received from their employer's HR department. The challenge here is health plans are trying to manage an intensive member management experience that happens in any retail market, together with their role and responsibility around guiding health decisions, guiding care paths, and getting people into the treatment situations that they need, while trying to maintain their ACA cost ratios. And so the challenge is really incredible to try to maintain in a retail marketplace to support a retail member at the same time you're trying to keep your administrative costs below 15%, and you're trying to manage medical costs aggressively. So there's really no way to do that, to manage the cost equation at the same time without using technology creatively to do it. But it's not only a cost issue. What we're finding with our clients is you've got clinical resources in many cases that are using their time very inefficiently today, dialing for dollars, reaching out, trying to contact the diabetic population to try to move them into a care management program. And that's not something that nurses like to do. They want to talk to patients. They want to guide patients. If they could, they'd spend all their time talking with patients and doing that work. So by coupling that team of clinicians with technology, you can actually enable those folks to spend more time sort of at the top of their license, managing patients rather than spending their time, trying to identify the right people. Is it the right time to speak to them? Are they willing to speak to someone about this issue? And would they like to do it right now? So we can actually increase efficiency of the humans and increase their job satisfaction and have them doing what they're most valuable doing.
Stan, this is Brent, and welcome to the program. One of the things that we as consumers, whether it's employee consumers or just consumers on a daily basis of any product, we get a lot of information from a communication standpoint. Is there a risk in this healthcare space of kind of information overload to these consumers?
It's a real issue, Brent, and we're seeing it right now for the first time in the data. And you can consider it sort of engagement fatigue in the world of consumer engagement. Mm-hmm. And remember, there are a number of decisions that people need to make in managing their own health, and many of them are very important. So, and the challenge is delivering the right information to a person at or around the point at which they're making that decision. So timing is critically important. But at that moment of truth, you need to have, you need to be in a relationship of trust with the consumer so they can understand, hear, and value what you're trying to guide them to do. Mm-hmm. Today, it is rare that a health plan even knows how many communications they're sending out to consumers in their market. Wow. I have a friend who is a senior manager at a regional health plan, and he actually went to the extent of having every piece of mail sent from his health plan to anybody sent to his home address so that he could learn what they were sending to their membership. There was no other way for him to do it. Huh. In other examples, our clients have actually gone out and done clipboard audits of their organizations to figure it out. The numbers are staggering. Yeah. Health plans send thousands of different communications to consumers from their health plan. Now, some people get completely ignored. They get nothing from their health plan, and other people are getting completely overwhelmed. And part of this is figuring out how to, first of all, see that. What are you actually doing to the consumers? Because remember, the only experience a consumer has with their health plan is communications. So today, this is an uncontrolled process, and there's no lens through which to view how you're treating your membership with the only member experience that they have. So it is a real concern, and I think we're at a point now where we need to introduce controls around what is really an uncontrolled process and highly, decentralized. So we need to find ways to gain control over the member experience, and it is a real issue because when we need their attention, they won't be paying attention because we wore them out in other ways. And
in some cases, to your point earlier, talking about who you work with, it can the information can even be quadrupled because you might have a separate health management company trying to communicate with those employees. You might have a separate transparency engagement tool trying to communicate with the consumers and members as well, right?
Absolutely. The ecosystem is large and, again, uncontrolled. So you've got your pharmacy, you have your doctor, you have the provider system, your hospital, your health plan, your employer. The ecosystem that is now concerned and increasingly aligned with trying to drive those appropriate behaviors is a broad ecosystem, and their voices are loud. And again, the key is going to be to deliver, honestly, less information, but the critical information in a way that is digestible by the consumer and is delivered at times that make sense to the consumer and are delivered, close to the points at which they're making decisions.
Does that stand how you?
Important.
Yeah, that's a good point. Is that how you're kind of tying in big data as well to better understand the consumer members and when and what type of communication to send them?
Absolutely. I mean, big data is a big place, and we live in a part of big data. Yeah. What we're focused on at Silverlink is really motivating health behaviors and understanding segments of the population and what motivates incremental best behaviors. So really, historically, we've looked at the data about population behavior change. We've tested interventions with that population and then measured which are the best interventions within which subpopulations, and that way you learn things about ethnic messaging and different segments of illness burden and all that kind of stuff. And we've been doing that for a number of years. Today, we're going a little further than that by saying, let's understand the patterns of consumer engagement across multiple engagement settings over time in in light of those intervention strategies. And that actually allows us to do things like score engagement levels at the individual member. And that's actually contributing a new source of data to the big data in healthcare. And obviously there's tons, consumer markets look at this industry and are drooling at the amount of data we have about consumers that they can never get to sell, food products, right? But so big data is a huge place in healthcare. Our world is really very focused, but we are introducing a new source of data around understanding behaviors of populations because, like in many other areas, the best predictor of future behavior is past behavior. And we're able to sort of look broadly across consumer behaviors. We can actually do a terrific job of predicting future engagement and future decisions by consumers. And that's, again, as I say, sort of a new source of data for this world of big data.
So that's some of the new things that you're working on and rolling out to the industry.
Well, as I mentioned, health plans are the world of consumer engagement in health plans is a very decentralized, very uncontrolled process. And really what we're looking at and doing right now is helping plans organize information about consumer engagement at the consumer level. So I can create for you a longitudinal engagement record for an individual, and I can also house your preferences and permissions and data about how to contact you, what's most successful, and how you want to be contacted in a way that's accessible by the multiple stovepiped organizations within the average diversified health plan. And once you start looking at the data as we're doing today, and we have hundreds of millions of records in this technology we call EngageMe, once you start looking at the data about engagement, it teaches you things. It teaches you that how many times you're connecting with each member, who's getting ignored, who's getting overwhelmed, who's responding, who's engaged in their own health, who's likely to be engaged when you reach out and try and recruit them into a health management program. So we're just starting to tap into this new source of data about consumers and their behavior, and we've developed a technology that allows our clients to look at the consumer through this sort of new window and help make different decisions, how they can reduce their cost, how they can consolidate messaging and make it more impactful, and how they can continue to improve the engagement rate of their consumers. So that's sort of new from what we've been in the world of executing multi-channel campaigns to motivate behaviors for years and years now. And this is really taking that data that's been generated over 10 years and 1 billion touches and helping plans look through that lens to understand how they can better optimize their business and optimize the health choices that their consumers make.
Well, Stan, we really appreciate you having you on the program. We've got a lot more that we'd love to cover with you and love to have you back. We're at the end of this segment. Really appreciate it. Have a great weekend. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.